I remember the first pronouncement I was involved in. It was at my first job for a private EMS service in the burbs. It was early one morning that we worked a 60-year-old female who woke up dead. I was so new that I was third riding as an EMT. I wasn't even partnered with a medic at that point. Even at that shiny new part of my career, I remember thinking that our crew had performed the process wrong. That's what I want to talk to you about today. I'm Angry Bill, and this is Pre-Hospital Wisdom. We understand that medicine is medicine, but pre-hospital providers have special skills, knowledge, and culture that other providers don't have. Let's raise the bar here a little bit. The patient was worked in a bedroom while the family sat in the living room waiting. She was probably an asystolic arrest that we gave a round or two of meds to before calling it. I don't know, like I said, I was a new EMT. I remember that the medics and firefighters pronounced the patient, cleaned up their mess, and began taking equipment out to their bus or fire truck, through the living room, past the patient's family, before we notified them of the outcome. The family was probably still hopeful, then confused that the heroes were leaving. When one of the paramedics did tell the family about the patient's status, he told them that she had moved on. I recall vividly that her husband asked where she went. He wanted to meet her there. I think in his mind the experts arrived because his wife wasn't breathing. Then the experts were leaving, so she was either better or she was transported. Maybe out through the bedroom window or something? Brains don't always make sense in times of stress. In the years since, I had two main points that I had taught to new medics. My goal was to avoid situations like that one. First, don't ease into a death notification. Band-aid that shit. It's easier for providers to have a little throwaway conversation before we get to the hard stuff. It's not easier for the family, though. The problem is that introductory conversation to a medic involves something like, "So, has she been sick lately?" You have just tied any answer that the family member has to her death. "Oh God, I knew I should have made her get checked out. This is my fault." The second main lesson that I pushed is to use the word dead at least 3 times. Dead, death, or died are your only choices. Don't use euphemisms like she's gone to a better place or is no longer with us. Be clear, say dead, and it takes 3 times to sink into a grieving brain. A few years ago, however, I ran across the grieving mnemonic. It works similarly to what I was doing. So let's talk about that. See if it helps you. I'm not necessarily a mnemonic fan, but if it helps you, it helps you. G, gather. Get all the family together. Ensure that everyone is there and optimize the environment. Make sure it's quiet and private. Have everyone sit down. Fainters are hard to pre-identify. Get at their level. Make eye contact. Gather yourself, too. Tuck your shirt back in, wipe the sweat off your forehead, and slow your pulse rate if needed. You're transitioning from a hardcore street medic working in arrest to being more of a comforting social worker. Lower your voice to that of normal conversation. Speak clearly. R, resources. I think this one's kind of out of order. This step is to call for additional support resources like chaplains, other family, and so on. To me, this should be after the inquire step, but then the mnemonic makes no sense. I, identify. Tell them who you are and identify the patient by name. My name is Angry Bill, and I'm a paramedic with the city. I was in charge of taking care of Joe. Use the patient's name. Never refer to the dead as another word, the arrest, the patient, the body, your mom, whatever. He is Joe, and that's how you should refer to him. I hope that is common sense, but it really is important to be able to use the deceased person's name. E is educate. Update the family about what was found and what was done. Explain that you found them without a pulse and not breathing. We performed all the same treatments that would occur in any hospital. We put a tube in his lungs to breathe for him, performed CPR, and gave him powerful medications. V, verify. Use the word dead or died. I still go with the 3 times rule. I'm sorry to tell you that even with all that, Joe has died. All the treatments we performed could not save his life. Joe is dead. It looks like he died peacefully in his sleep during the night. If it doesn't look like he died peacefully, don't say that, trust me. Experience is talking here, don't do that. Space. Give them space to absorb the information. Don't leave because they will have questions. Just shut up. Be a professional, sit there, and console them, one human to another. Put your hand on theirs, put a hand on their shoulder maybe. Even just sit there and witness their grief, if it's all you can muster. However their bereavement manifests, do not take it personally. Some people wail, some people strike out, some will throw themselves to the floor, and some people just stare. Do not restrain them unless they're a danger. And I know you might be nervous and want to keep babbling. I don't care about your nerves. Shut up. Inquire is the next I. Ask if they have questions about the situation and if there's someone you can call for them. Is there anyone that I can call to help you, like a minister or a family friend? They may have questions that you can't answer, like what caused their death. Don't guess. Say you don't know if you don't know. N. Nuts and bolts. Explain the process from here. This is system specific, so make sure you know your jurisdiction's rules. In my system, any out-of-hospital death needs police involvement and a coroner's consultation. Explain that to the family. I explain that the police are well-versed in this process and will take good care of them. Jill will probably have to go to the medical examiner's office. Explain that your treatments have to stay in place for now, so the IV line and breathing tube are still in there. If the police officer is good with it, give the family a chance to go sit with Jill and say their goodbyes. In my system, the ability to do this is dependent on factors that the police know, but I don't, so I leave it up to the cop. It's something that I wouldn't have realized not wanting to do it myself, but it can be deeply helpful for some people to be able to say goodbye directly to their loved one. And G is give a card. This step is really more for victims advocates who deal in death notification. If you want to give a card, knock yourself out. But one way or the other, I would replace this by handing off the care of the family to another professional. Introduce them to the police officer that's on scene. Wait on scene with them for the officer to arrive if need be, and introduce them. Relating back to the pronouncement I explained at the beginning of this post, don't start moving equipment or responders out until at least the space step. Duh. So here's a list of good things to say. I can't imagine how difficult this is. I'm so sorry for your loss. This must be hard to accept. How can I help? I know this is very painful. Dumb things to say. Anything religious. This is a blessing because you're lucky that at least get a hold of yourself. You don't need to know that. I can't tell you that. Things always work out for the best. I know how you feel. My blank died last year. Many articles that explain the death notification process suggest allowing the family to view the resuscitation process. It makes some sense theoretically in the right setting. Even a fairly incompetent resuscitation scheme seems skilled to a layperson. The family gets a feeling that everything possible was done. They probably won't know that you can't get the tube unless you say, "God damn it, I can't get this tube." It makes me a little uncomfortable though. My practice used to be to update the family at several points during the resuscitation if I could. There can be times when we're just waiting for the 2-minute cycle of CPR to get done, and I can go give a situation report to the family then. Think of this as prepping them for the potential notification. But I've recently had family members in the room while my team and I were working the arrest. It went fine. Try it. It's fine. And it's good for the family. The final point I want to make is don't be a wimp. This is part of your job. Hit your big boy or big girl pants up and go do it. Do not transport futile resuscitations in order to pass off the notification process to an ED. Family members of pronounced patients report less positive interactions with providers and more anxiety rushing to the ED than they did those that were pronounced unseen. You're giving the family hope when you drive off with their loved one, sirens wailing and lights flashing. Remember, no notification is easy, but you have one of the relatively easier ones. Sack up and do your job. Picture how much more difficult it is to a police officer who has to knock on a door, wake someone up, and start from scratch. Surprise! And then throw in body identification. Picture how much more difficult it is for a physician to explain brain death versus death to someone grieving, or organ donation requests right after a notification. Sack up, do your job, notify the family when the pronouncement is warranted. Your skill at giving death notifications has a huge impact on how the deceased family will process this change in their lives. Do it right. Let me know what you think and comment with your process if you would like to share it. One of the most helpful things you can do is share this content with someone you know. Click here for another video, or click here over on this side for the channel page and all the videos. Subscribe, I think, is below. I'm Angry Bill. This is Pre-Hospital Wisdom, and until next time, stay safe.